Bore da, good morning everyone, and croeso, welcome. Today's meeting has been convened to consider the Health Board's annual report and accounts for the year 20 to 21. It's being held virtually and live streamed via the Health Board's website. I'll introduce the participants myself, as this is a virtual meeting, it's easier. I'm Vivian Harpwood, Chair of the Health Board. Also present are Mel Davis, Vice Chair of the Health Board, and independent members Ian Phillips, Mark Taylor, Tony Thomas, Susan Newport, Trish Buchan, Matthew Dorrance, Robert Lewis, and Francis Gerard. The Chief Executive, Carol Shillabeer, is present, together with the following Executive Directors: Hayley Thomas, who is Deputy Chief Executive and Director of Planning and Performance, Jamie Marchant, Director of Primary Community Care and Mental Health, Pete Hopgood, Director of Finance and IT, Stuart Bourne, Director of Public Health, who's been very, very busy this year, Kate Wright, Medical Director, as have we all, of course, Julie Rolls, Director of Workforce and OD, and Lucy Cornish, Deputy Director of Therapies and Health Sciences, who's here for Claire Marsden, who's on annual leave. In addition, we have with us Rani Mallinson, Board Secretary, and colleagues from the Corporate Governance team supporting the meeting. Colleagues, and welcome to you from Audit Wales, who've undertaken the audit of the annual report and accounts, and you'll be introduced in a few moments personally. Katie Blackburn is here from the CHC, and also Francis Hunt, who will be observing, I think, because of technical IT difficulties. Please note that participants will look away from the screen from time to time to access notes and other documents. I think that's really all we need to say, because we need to get on with the agenda itself. So moving then to the agenda, which is published on the Health Board's website along with the papers for today's meeting. Agenda item 1.2, are there any declarations of interest, please? No, that's good, thank you. So we'll go on to agenda item 2, and this is a really very important part of today's agenda, dealing with the annual report and accounts for 2021. And I'll hand over to Pete Hopgood, Director of Finance, and Rani Mallinson, and Pete will introduce colleagues personally from Wales Audit, who will then speak to the meeting. Over to you, Pete.
Thank you, Chair. So to receive item 2.1, which is Audit Wales Audit of Accounts Report, I'd like to introduce you to Derwyn Owen and Alison Butler from Audit Wales, and I'll hand over to Derwyn to present their report.
Thank you.
Thank you, Pete. Good morning, everybody. As Pete says, I'm Derwyn Owen. I'm an Audit Director in Audit Wales, and in the next few minutes I'll just take you through some of the key conclusions in our audit report for this year. I'll start with a reminder of what our responsibilities are, which is to provide an opinion on your financial statements and remuneration report, and that takes the form of two elements. Are your accounts a true and fair reflection of your financial transactions during the year, and is the expenditure contained within those accounts regular? I'm pleased to say that the audit is in the very final stages of its completion. In our report, we note a few outstanding areas of audit work, but I'm pleased to say that by this morning we have reached that point where we are now literally doing the final checks of the revised accounts. Having been notified just now that the Remuneration and Terms of Service Committee has approved additional payment, and the work which was outstanding on the drugs estimate has also been completed. I think it's fair to say that is a good position overall. It remains a struggle to work remotely, to audit remotely within the COVID restrictions, but I'm pleased to say that we are there or thereabouts in terms of the final elements. In terms of key conclusions, I'm pleased to say that overall it is the intention of the Auditor General to provide an unqualified audit report in relation to your accounts, and that is to state that he does believe that your transactions do reflect a true and fair position of your financial transactions. In terms of a few details, there is one misstatement which has not been corrected by management, and we look forward to receiving representations from management as to why that is in due course. I should add that the management not correcting that misstatement does not cause us any issue or problem. In terms of other misstatements which management have corrected, those are listed in Appendix 3 to our report, and therefore I wasn't planning to dwell on those at this stage. I wish to talk through some significant issues which arose from the audit. They are listed out in Exhibit 2 of our report. The first is an identification of a weakness around some procedures in relation to the payment in lieu of notice of an executive director, that the payments were not in accordance, hadn't been initially approved, but pleased to note they have now been approved. But also some procedural weaknesses that led to an overpayment as well. They also recognise that the Health Board is actively pursuing that overpayment. So that's taken some time to work its way through, but we are satisfied now with the overall position in relation to that. I would also comment more generally on the remuneration and staff report. Clearly it is an important document setting out the key salaries and remuneration of senior staff. I think it has been an area which has taken some protracted audit to ascertain some of the positions and probably a fair few amendments. I think we're satisfied that by now we are in a position able to say that the revised version is a true and fair reflection of the position. But I think there is some cause for reflection for the Health Board in terms of its procedures for next year as it looks to prepare its remuneration report. The final matter I want to pause upon this morning relates to the Clinicians Pensions Tax. First thing to say that this is an all Wales matter, so this is not just about Powys Health Board, this is an all Wales matter. And of course, it was also prevalent in last year's accounts. You have disclosed a contingent liability in relation to future payments, as have other health boards across Wales. The Auditor General has determined that that note is important enough such that he wishes to draw the attention of the readers of the accounts to that note. And therefore, in our audit report, there is what is called an emphasis of matter. It is not a qualification on the audit report, it is simply the Auditor General drawing to the attention of the reader of the accounts the note which you yourself have prepared in relation to this matter. The Auditor General further, though, has determined that the matter is significant enough such that he wishes to comment more generally on the matter in his audit report, and therefore towards the end of our audit opinion you will see a handful of paragraphs which sets out the position in relation to the Clinicians Pensions Tax. As I say, this is not a matter solely relating to Powys, this is an all Wales matter. And I think at that point I will pause and say those are the key conclusions arising from this year's audit, but also to put on record my thanks to Pete and his team for their support during the audit this year. I'm happy to take any questions.
Thank you, Derwin. Thank you. Does anyone have any questions? I can't see any questions coming in, Derwin. So first of all, just like to say thank you for taking us through your report. Just to highlight that we are committed to the learning from the experience going forward so we can improve our response and actions in future years. To note that the audit report has been to our Audit Risk and Assurance Committee, but there's been a number of changes since that meeting has highlighted. And just really to echo your thanks and say thank you to yourself, to Alison and to the whole team. It's been a new team relationship. Really appreciate the support and the working through issues. And as you say, doing things virtually does not make life easier. So just to really record my thanks and the thanks of the board to yourself and the team. And I did just know, I think Carol wants to come in. So Carol.
Yeah, thanks very much. I know that for board members and anyone who's watching this meeting, members of the public, we will be going through in a little bit more detail some of the key aspects, and so there may be some questions as we go through. But I also wanted to thank Audit Wales colleagues. This is the first year that we've had Audit Wales colleagues doing the annual accounts and governance annual report review. We have previously had external audit provided for this part of the function by Grant Thornton, something that Audit Wales contracted with. So that on top of a pandemic has undoubtedly made this an unusual year for this audit process. So I would like to thank both Audit Wales colleagues and colleagues in the Health Board for working under really quite pressured circumstances to get the audit report here. I've just recognised Derwin's comments about outstanding elements of audit. It's not usual that we've got some elements outstanding by this stage, but Chair, I think in discussion with the Audit Committee, we've put in additional steps to ensure that board members in particular have been able to give consideration as people have been working right up to the wire here. So thank you very much, Derwin, and I'd reiterate the thanks to Pete and the other teams who've been involved here. And I know that there will be questions as we go through the rest of the report.
Thank you, Carol. Okay, so that concludes item 2.1, subject to any other comments. So if I can take us on to item 2.2, which is to receive the recommendation from the Audit Risk and Assurance Committee in respect to the annual report and accounts for 2021. So if I can bring in Tony, please.
Okay, can you hear me?
Yes.
Yes, well, that's good anyway. Thanks very much, Pete, and I think I'd like to praise the efforts of your staff and the assistance given by external audit through this process. You know, bringing in new external auditors, as well as having to deal with pandemic and issues related to that, means a very difficult year. But it's great to see that the accounts were complete by the statutory date, and I think your team and to external audit accept our satisfaction for that. The Audit Committee had quite a discussion on the performance report, the annual accountability report and the financial statements yesterday, and the recommendation is that the Audit Risk and Assurance Committee recommends to board that it approves the annual report and accounts for 2020-21, which includes the performance report, the annual accountability report, and the financial statements. It also approves, the board also approves the letter of representation and authorises the Chair, Chief Exec and Director of Finance and IT to sign them where required. don't wish to make any further comment other than to repeat what I said. What an excellent job both Pete's team and Audit have done over this difficult period. And perhaps somebody would move the recommendations or accept the recommendations from the Audit Committee, please.
Yes, can I just come in there, please, because we're going on to consider for approval the annual report and accounts for 2021. There is a cover paper. I don't propose to talk to that, but could we perhaps bring in the next item, unless there are any questions for Tony? Okay. So could we then proceed with the rest of the agenda? Thank you.
Thank you. Thank you, Chair.
That's great.
Yeah, thank you, Chair. So we're on to 2.3.1, which is part one of the reports, the performance report, which is Hayley as Director of Planning and Performance.
Thank you, Pete. Bore da pawb, diolch Cadeirydd. Dwi'n falch iawn i gyflwyno yr adroddiad perfformiad sydd yn rhan o'r adroddiad blynyddol i'r Bwrdd Gymeradwyo. I'm really pleased to present the performance report section of the annual report for today's approval. The performance report is recommended for approval by the Audit, Risk and Assurance Committee and has been through a process where we've received comments and feedback from a number of different committees, including the Performance and Resources Committee, the Executive Committee, and also follow-up meetings with independent members and recommended amendments received from Audit Wales. The purpose of the performance section of the annual report is to provide information on the Health Board's business, its main objectives and strategies, and the principal risks that it has faced. Clearly, it's been an extraordinary year to cover, and in response to the COVID-19 pandemic, the reporting requirements have been reviewed and streamlined, and we have ensured that we are meeting regulatory matters in terms of the content of the report presented. For example, there has been no requirement to submit a performance analysis section, a sustainability report, or a separate annual quality statement for this year. But given the importance of these elements of reporting, the report does contain information to try and provide as full a picture as possible of the year that we have faced. The report provides an update on Powys and its population, and the performance overview also picks up key elements around the planning and delivery of safe, effective and quality services for COVID, but also to cover for non-COVID care and including essential healthcare. We also include the latest information and data available to demonstrate our performance against key areas of the NHS outcomes framework. Quality and patient experience is at the heart of our business and is a key feature within the report, and it informs all aspects. In addition, a specific section has been included giving key indicators in relation to quality monitoring. We have very important enabling pieces of work which are covered within the report, and some examples I'd highlight is around workforce, digital and the progress made during the year in partnership with all of our partners, both within Powys and across with neighbouring players, both within England and Wales, and also communications and engagement and our work around equalities and Welsh language. Whilst there's no requirement for the sustainability report this year, the report also includes important information to show progress around key areas, including decarbonisation, environmental management and the Future Generations Act. We have included in the report a forward look, and clearly the final draft of the annual report annual plan will be coming to board later this month for approval. So we've ensured that we've reflected our priorities going into the next year. And the final point I'd highlight is that I think we should feel very proud of the progress that we've made during this year in very difficult circumstances. So there are a number of individual and team achievements included throughout the report, and a roll call of the staff appreciation certificates to show the example of dedication that our workforce and our staff have shown throughout the year, working in partnership with key individuals, key partners, including the local authority, the third sector, the Community Health Council, and many others, which are too many to name. So we'd like to recommend today, Chair, the report for approval. I'm very happy to take any final comments or questions.
Thank you, Hayley. Are there any questions? Robert Lewis. Oh, Robert, you have some questions, please, on referral to treatment.
Yes, thank you, Hayley, for a very comprehensive report. A lot of work gone into this, and I know I'm sure all the members of the board would like to congratulate those involved, because of course doing this on top of everything else. I do have some questions on the RTTs, and the page number in my set documents is page 65. There's a table there of RTT performance against national targets by month. I noticed that the total number of patients waiting remained roughly the same during this period, around about 3,500 patients. Obviously, the number of patients waiting, for treatment, the waiting lists have gone up and they're coming back down. I just wondered is there any indication from modelling as to whether the total number of patients waiting will go up because of, for example, late diagnosis? That's question number one.
Thank you, Robert. It's a really important question. You'll note that this information takes us until the end of the financial year. We are working with unvalidated waiting list positions to operationally manage the position for both as a provider. We have obviously the information, but also for commission services as well. So we continue to monitor that. There has been some improvement in some specialties, but generally there is an increase currently to the position for over 52 weeks and over 36 weeks, generally for the aggregated position for both commission services across both England and Wales. I think that your point around the ability to develop a trajectory around this, as part of the annual plan that the board will receive, the final plan at the end of this month, we have to submit a minimum data set to Welsh Government where we've set the trajectory as a provider, but where we're expecting to see improvements around our referral to treatment time. And we have secured some investment from the £100 million Welsh Government fund to support improvements in planned care waiting times as well. So we'll have that information as a provider as part of the annual plan. We're currently in ongoing discussions with all of our neighbouring providers to understand the trajectory that is set for improvement around referral to treatment times. I don't have that information in front of me, Robert, but we'll be able to bring that information to either the board or a performance resources committee so that you can see what the planned trajectories are in terms of dealing with the backlog. Your key point around that's the demand that we know. We still have some uncertainty around potentially the latent demand of people who may not have already, for whatever reason, presented with issues. And obviously we'll be tracking that as well during this year to try and make sure that we understand the improvements that we're making and the progress. But it is a very significant backlog, and it is going to take us a significant amount of time to recover the referral to treatment time waits for our population, both as a provider and as a commissioner. Is that sufficient, Robert?
I'm going to just follow up with one question, really. It was about another table which shows the RTT weights for different providers. So this is on page 66.
Yeah.
What's interesting, if you look, for example, at three big providers, Anarion Bevan, Shrewsbury and Wye Valley, the differences in the achievement, if you like, seems to be very early on, and then from 53 to 76 weeks, those two zones, if you like. And my question really was, are these trends where, you know, the Shrewsbury and Wye Valley seem to be performing better than, let's say, in Iron Bevan, are those trends have they been observed in previous years? You know, is this a long-standing difference, if you like?
Yeah, prior to the pandemic, we had different positions across our providers. There's been a general deterioration across all as a result of the pandemic, but the starting position was also different. I would say that it's difficult in such a high level report. The devil is in the detail, and there are some progress. There's progress if you look at it at a specialty level. You can look at it in a bit more detail. But I'm thinking particularly, Robert, with the interest around this, we could give that breakdown through to the Performance and Resources Committee so that you can see sometimes looking at the overarching position gives you one view of the world, but when you actually look at it at the next layer of detail at a specialty level, you can see there are certain specialties that are different, and we're able to sort of cover that detail and provide you further assurance on those points.
Thank you very much. Thank you, Chair.
Thank you, Robert. Good questions there. Very important, of course, going forward. And another independent member, Trishba, can you have a question?
Yes, good morning, Bore da pawb. It's more, well, a comment and a question, and it relates to page 30 and 31 of the performance report. And my comment is just how pleased I am to see that we're recovering in our child and adolescent mental health outpatient referral times. It was something I was quite concerned about early on, and I'm pleased to see that we've made, you know, some significant efforts in the last couple of months. My second question relates to the 8-minute ambulance response time, and clearly that hasn't, we've had problems in that being met for our population, and I wondered if you could tell us a bit more about the conversations that are going on with WAST.
Thank you, Trish. I'm wondering whether, Jamie, you'd like to come in and provide a response to this question.
Yeah, very happy to, colleagues. Hi, Trish, thanks for that question. I think I might have summarised this in the last formal board meeting that we had, but very happy to touch upon it again. You're absolutely right. I don't have the exact figure in front of me right now because of my computer, but it has been a challenge. We work closely with Welsh Ambulance Service Trust, of course. It is a disappointment to Powys as a health board that probably only once in the past 18 months have we achieved that 65% red target set. I think I would outline that we are linking quite actively with Welsh Ambulance Service. I had a meeting only about 2 weeks ago to understand what the proposals can be to improve that on a recurring basis, because even when we had less handover delays in the DGH hospitals across the rest of the border, both England and Wales, during the early parts of COVID, they were unable to hit the 65% target. There are handover challenges, of course, because, of course, ambulances need to be cleaned and decontaminated post-transfer patients. So there is a natural decline, but it is a challenge. And there's a proposal around what they call a rural model and how we can have a quicker response on the 8-minute target, Trish. I think this is a work in progress. I'm awaiting a formal response from them on a formal proposal of what they can do, what we can do to help with partners, because, of course, it is a partnership approach on that. But it is a key focus for us, and this report just highlights why it should be a key focus for the health board.
Thank you, Jamie.
Thank you. Are there any more questions, please, for Hayley? Well, if not, then can I ask that in accordance with the recommendation of the Audit, Risk and Assurance Committee, the board approves the performance report section of the annual report for 2021 for signing. Everyone happy? Thank you very much. Thank you.
Thank you.
So we'll continue then with the next part of the agenda, 2.3.2, and I'll hand over to Chief Executive and Board Secretary.
Thanks, Chair. I'll introduce if that's okay. So the annual accountability report is required to have 3 sections. The corporate governance report, which explains the composition and the organisation's governance structures and the arrangements for achieving our objectives. The remuneration and staff report, this contains information about remuneration of senior managers, fair pay ratios and sickness absence rates. And if I can propose at this stage that we take the remuneration and staff report for approval as part of agenda item 2.33, as there have been some small changes since the papers have been circulated that Pete will take us through in the next item. And then the third section of the accountability report is the Parliamentary Accountability and Audit Report, and much of that information is included in Audit Wales Audit of Accounts report, which was presented earlier. So I'm going to focus on the corporate governance report, if that's okay. So there are again 3 core parts to this. The directors report, which includes composition of the board and members' details, membership of the Audit Risk and Assurance Committee, information on the management of declarations of interest and personal data related incidents, relevant information on environmental, social and community issues, and of course COVID-19 is included within that section for this year, and a statement for public sector information holders which confirms that the Health Board has complied with the cost allocation and charging requirements set out in HM Treasury guidance during the year. And the second section is a statement of accountable officer responsibilities. This explains the accountable officer's responsibilities for preparing the financial statements. Within this section, the accountable officer has confirmed that as far as she is aware, there is no relevant audit information of which the Health Board auditors are unaware, and the accountable officer has taken necessary steps to make herself aware of any relevant audit information and that has been shared. And also within this statement, the accountable officer confirms that the annual report and accounts as a whole is fair, balanced and understandable, and that she takes personal responsibility for the annual report and accounts and the judgments required for determining that it's fair, balanced and understandable. And there's a statement of directors' responsibilities in respect of the accounts. That is a statement which will be signed by the accountable officer, chair and Director of Finance and IT on behalf of the directors of the Health Board. This statement confirms that the accounts give a true and fair view of the state of affairs of the Health Board and of the income and expenditure of the Health Board, and also that the board is clear of its responsibilities in relation to keeping proper accounting records that disclose the financial position of the Health Board and to ensure that the accounts comply with requirements set by Welsh Government. The third section, which is the main section of the report, is the annual governance statement, and I'm going to hand to the Chief Executive for that section. Thanks.
Thanks very much, Ronnie. I think it's often been said that this has been an unprecedented year, and in relation to the annual governance statement, I think we can see throughout that the need for this board to be both flexible and to modify the governance arrangements without losing sight of the requirements to uphold public expectations around governance and conduct, including the appropriate use of resources. So I'm grateful to colleagues who have helped us through the year to check on our progress, both in terms of internal audit and Audit Wales, and to colleagues internally for demonstrating a high standard of governance through what has been the most challenging time. I did want to just mention a couple of things, really, if that's okay, before I move to a conclusion in terms of my contribution to presenting this item. So it is really clear by the fact that we're live streaming and holding public board meetings by digital means, that we have made efforts and in fact strides in trying to ensure that our business is held in an open and transparent way, maintaining good governance through the pandemic, and in ensuring. And I actually think my own reflection is that people are able to engage even in better ways with us now through the digital means than perhaps previously. So we've taken significant steps to maintain that openness and transparency. I do want to flag, I mentioned internal audit, but the internal audit opinion, of course, we'll touch on that a little bit later, I'm sure, is a reasonable assurance, but I do want to just draw attention to one limited assurance rating, which is yet to be fully finalised. It's in draft status. And that relates to Llandrindod project, and that's being finalised. I do believe the findings of that, even if it remains in the limited assurance rating, would not have a material impact on the annual governance statement. And in the same way that we've had some changes with Audit Wales colleagues, our thanks to the internal audit colleagues who are moving to another health board and will have some new fresh eyes coming to help us as we progress this year. So in conclusion, I believe that the board and its executive directors particularly are alert to the accountabilities in respect of internal control, and that the board has had in place during the year a system of providing assurance aligned to the corporate objectives that have assisted us with managing risk that we have had to deal with through the year. As a result of our internal control arrangements, we continue to be at a routine level of monitoring under the Welsh Government's escalation and intervention arrangements. They will continue to be under review by government. That we will and have been taking forward our annual governance programme, and grateful to colleagues for the active participation in that will help us to improve our system of internal control. That we will continue to mature as an organisation, recognising we have areas of strength. Although we don't have any significant internal control or governance elements, we will continue to develop organisationally, and the board will consider a revised organisational development framework in due course. And that, as indicated through the AGS, I just want to thank everyone in the organisation and our partners for the support that we have had in managing through the pandemic. It's required flexibility, dynamism, creativity, and a huge level of commitment. So just in terms of drawing my contribution to presenting this item to a close, we couldn't have done it without those colleagues, and would like to thank them. Thanks very much.
Oh, thank you. Thank you, Carol. I echo that. We've been very, very fortunate to be supported by so many helpful colleagues from outside the organisation, as well as working hard within the organisation. Are there any questions on this section of the agenda, please? Okay, well, in that case, again, in accordance with the recommendation of the Audit, Risk and Assurance Committee, could I ask the board to approve the Annual Accountability Report section of the Annual Report for 2021? Yes, thank you very much. That's the only flaw with this system, that it's not possible for everyone to sort of say yes, yes, yes at the same time. So thank you anyway. And we'll continue then with the next section of the agenda. Pete, please, if you'd like to take over the annual financial statements.
Thank you, Chair. Thank you. So included in the board papers is the detailed annual accounts that were as considered at the Audit, Risk and Assurance Committee. There have been a number of amendments to the accounts as included in the pack, subject to the comments made by Derwin earlier and some other issues, so I will take you through those amendments shortly. Also included in the pack is a summary presentation, really just to give a bit of an easier read overview of the accounts. And what I'd like to do is remind the board that we met our statutory duty to remain within our revenue resource limit and our capital resource limit, which is a fantastic achievement given circumstances of the last year. So I'd like to congratulate the whole organisation in delivering that position and thank them. So if I could just take you through the amendments that have been made to the accounts as in the pack. If Caroline can share the slides that we've got, I would just take you through these item by item. None of these have a material impact on the bottom line and overall financial performance, so I'll just take you through them point by point. So on page 2 of the accounts, there's been amendment to the table included to add the word restated for the column 1920. On page 28, in relation to notes 3.1 and 3.2, the word restated has been added to the columns for 1920 in both of those tables. On page 55, note 221.1, there's been amendment to the figure of 16.561 million has been changed to 16.889 million, and that's in relation to legal claims for alleged medical or employer negligence. And on page 55, note 21.2, there's been an amendment to the header that now reads Pensions Tax Annual Allowance Scheme Pays Arrangements 1920. Page, please. These next amendments relate to the Remuneration Report, so are an important amendment to the items that we previously discussed. On this slide, you will see the items highlighted in yellow as where there's been an amendment. These amendments include a restated categorisation against the headings for 1920, and then where you can see a yellow band, a yellow highlighted area, it's where the bandings have been adjusted to reflect the actual position. There's also been an update in relation to the narrative in relation to a number of positions. If I highlight myself as one of those, so we've included a clear narrative to the fact that I was in an interim position up until May 2020 when I became substantive. So that clarity's been added for the accounts in the reader. Next page, please, Caroline. Similarly, again, moving through the remuneration report, again, the restated heading has been added against those columns, as you can see, for the 1920 issues, and there's been adjustment to the banding category for the items as highlighted. Next slide, please. And then again, in relation to the remuneration report, there's been an update to the note in relation to the chair's role, both with ourselves and with WISC as highlighted. And also the final point is to note that the comparative information has been restated to correct errors in previous years, and that really relates to the restated heading also included in the previous tables. Hopefully that gives the board, oh sorry, I missed the final slide again. Similarly as to an earlier slide in relation to the salary and pension disclosure, there's been an update in relation to myself for the period I was in an interim role before becoming substantive. Thank you, Caroline. So I hope that gives the board an indication of those final adjustments that have been put through. These will be included in the submitted final accounts when approved. I'll pause there and happy to take any questions on the financial statements and in relation to those final changes that have been actioned.
Thank you. Thank you, Pete. Congratulations to your team. You know, you've done a wonderful job during this very difficult year. Are there any questions? No? Well, can I ask you then that, again, on the basis of the recommendation from the Audit, Risk and Assurance Committee, ask you all as a board to approve the annual accounts 2020 to 21 and the remuneration and staff report for signing, and taking account, of course, of the changes that have been included as just outlined by the Director of Finance and IT. Everybody happy to approve? Okay, thank you very much. Thank you.
Thank you.
So the next item on the agenda, 2.3.4, the letter of representation.
Thank you, Chair. So there's a requirement for the Health Board to submit a letter of representation to the Auditor General for Wales. The letter is based on a template which is provided by our Audit Wales colleagues. The draft letter has been considered by the Audit Risk and Assurance Committee and has been recommended for approval by the board. So looking for the board to endorse that and to approve for submission, please.
Thank you, Pete. Is everyone happy to approve that that letter of recommendation for signing as recommended by the Audit, Risk and Assurance Committee? Thank you very much.
Thank you.
That's excellent. I don't believe there are any more items for discussion, so I'd like to conclude by thanking everybody. I can't see that there's any other urgent business either. Thanking everybody, including Alison Butler and Derwin Owen, for all their conscientious work over the past weeks. It's a very difficult time for you as well as for us working in health boards, so we are grateful to you. Thank you for your support. And I think that brings us to the end of the meeting, and the date of the next meeting will be the 29th of June 2021, and the annual general meeting the 28th of July 2021. So thank you everybody, and that concludes the meeting.
Thank you.